also take some time to talk about the impact this is having on a number of different settings in our community, from hospitals to care facilities, nursing homes, assisted living, to our schools, including the health department. So I'm going to go through a little bit of that. And also on the call we have today Callie Kajawa, who is the incident commander at Bozeman Health, because I'm going to talk about some things that are happening at the hospital. They're working really hard to be able to consistently provide patient care, and that's being challenged right now by the number of cases we have. So yesterday, Gallatin County received 216 new case reports of COVID-19. That's way more than we've ever had in a single day. We continue to see people hospitalized in higher numbers than we ever did in the summer and early autumn. And the current situation is having significant negative impacts in our community, including the health department, those long-term care facilities like nursing homes. We're going to talk a little bit about how the hospital is being challenged by it, and in schools as well. The health department, the community needs to know that the health department can no longer keep up with this number of cases at this rate. We'll continue to fight. We're going to continue to do everything we can to make contact with everyone who's diagnosed with the disease in a timely way. But this is really challenging us to be able to do that. We're not getting to everybody we want to in the amount of time that we want to get to them. And that's limiting our ability to contain spread of the disease and to, and most importantly, protect those who are most at risk, such as people who are in nursing homes and assisted living facilities. You know, speaking of long-term care, as of this morning, we had most of our long-term care facilities in Gallatin County had at least a case, and many of them had multiple cases. We have one facility with 10 cases. We have another facility with I think 20 cases right now. It is really serious and significant, and those facilities are working really hard to do everything they can to keep the virus out of those facilities. But it's just very difficult when you have as much disease in the community as we have. You know, at Bozeman Health Deaconess Hospital this morning, the hospital initiated what is called contingency staffing, or they're calling contingency staffing in several parts of the hospital to maintain their ability to provide care. That staffing, that contingency staffing, has been done in consultation with my department, the health department, and under the guidance provided by the Centers for Disease Control about how to do that and about how to provide that sort of staffing in a situation where you have trained in a controlled environment. But I want to be really clear what that means. That means we're at a point where staff who've been exposed to the disease but are without symptoms, they're asymptomatic, and who otherwise would be in quarantine, are being asked to work and provide care in order to keep things going, in order to keep the hospital running. And I want to say Bozeman Health is taking a pretty conservative approach to this and keeping people out for as long as they can, for at least 7 days. But in order to continue to provide the care that they think is appropriate, they're having to ask people to come back before the end of their 14-day quarantine period. And this is happening because it's what's necessary to provide care for people in need. But let's be clear, this is not where we want to be. This is happening because we have staff who are being exposed to the disease in the community and are being exposed in a way that make them a close contact. We need everyone to understand that when you have gatherings or parties, when you gather at the bar, especially late at night when inhibitions come down, that allows this virus to spread and has a direct negative impact on our ability to provide care for people in nursing homes and assisted living and hospitals and in our schools. Speaking of our schools, we've had a number of schools that have made decisions to go to remote learning in recent week and over the past week. And that is happening primarily because they don't have the staffing to keep things going in the way that they want to, and because they have cases in the school. I talk to teachers almost every day, and I can tell you teachers, much like nurses and doctors and techs in the hospital, are putting everything they can into this. But they're tired and they're stressed, and some of them are scared. And so here's the thing, these problems are likely to get worse. Yesterday we had 286 cases. That's an indication of uncontrolled rapid spread. And as that happens, we expect to see more cases in our nursing homes and our care facilities. We expect to see more people who need hospitalization. We expect to see more schools struggling to maintain staffing. And we expect that we're going to be forced to announce more deaths due to the disease. What do we need? We need help from the community. We need everyone to understand that their actions matter. We need people to know that going to parties and to bars, being in crowded settings, and failing to practice social distancing is putting all of us at greater risk. As health officer, I'm advising all residents and visitors in Gallatin County to exercise extreme caution. Stay home when you can. If you have to go to work, as many of us do your best to practice social distancing and wear a face covering where you can't socially distance. Stay home when you're sick, no matter what. Consolidate your trips to stores, bars. Consolidate your trips to stores and limit them to essential needs. And be very careful about being in settings such as bars, restaurants, gyms, and places of assembly where we believe it's more likely that you catch and spread the virus. Assume the virus is everywhere you go because there's a chance that it is. These precautions are especially critical for people with health conditions that put them at risk. But I want to stress today that it's very important for people who are young and healthy to also be careful and to exercise these precautions because they can and are spreading the disease to others without even knowing it. This is especially important as we head into the holidays when many people will be traveling and seeing family, and nobody wants to bring the virus home for the holidays. And the things that we're doing now, know that the virus is out there in the community and know that those exposures are going to be impacting people 5, 10, and 14 days down the road from now. With that, I want to thank you all for being here. And if you have any questions, I'm happy to take those questions.
So you were talking about people that are having to work even though they are supposed to be in quarantine. Are those employees limited to working or to interacting with certain people, or is it possible that they could be like, are they only working with COVID patients, or are they working with everyone?
I'm gonna let Callie, do you want to talk about how that's working at the hospital?
Absolutely, I'd be happy to do that. So I'm Callie Kajawa. I'm leading our COVID efforts at the hospital and have been since February. We knew early in this pandemic that we would potentially experience challenges, with the supply chain as well as with staffing constraints, and we are majorly experiencing those constraints right now. As far as bringing back staff on a provisional work arrangement during their quarantine, we are following the CDC guidelines, which at this point in time, with the phase that we're in our anticipated staffing constraints, we are asking staff to stay home for 7 days during their quarantine, at which time we are bringing them back and we are applying additional infection prevention measures while they're there. So if the staff are available, or if they have the ability to care for persons under investigation for COVID-19 or actual confirmed positive patients, we will absolutely do that. However, we won't be able to do that 100% of the time because of the specialized nature of many of our clinical workers.
And
Keep in mind that we're talking about people in quarantine, so people who have been exposed, not known cases. So sometimes that word quarantine is thrown around pretty loosely. A quarantine by definition is somebody who's asymptomatic, who's been exposed and is potentially at higher risk. And what we're using with that to work with, the hospital is using Centers for Disease Control guidance. It's interim guidance that was updated last on November 6th for healthcare personnel with exposure to COVID-19. And so we're working through that. And I would say that, the hospital is implementing that in a way that is more conservative than even the guidance calls for. But it is serious. It is significant that we're in a situation now where the healthcare providers, and they're not the only hospital probably dealing with this in the country. And so it's significant that we're having to deal with it right now. Other questions?
What are those additional infection prevention measures that you mentioned?
Yeah, so we are asking staff to stay home for 7 days during their quarantine. If the turnaround times for testing are less than 24 hours or have a reasonable turnaround time, we're asking them to get tested before they come back. We are, like you mentioned, asking the operational leaders of the specific areas to find work assignments that are appropriate for that situation. We may have them wear additional source control. They must remain asymptomatic, so they must be checked for symptoms at least every 6 hours. But we are, as Matt said, doing more conservative measures. So we're checking them and documenting that every 4 hours in most of our areas. And then we have additional specific measures that they're doing, eating alone so that they are not around others when they're eating, and additional cleaning precautions.
Freddie?
Hey, Matt, how's it going?
Good.
Good. I was wondering, we kind of look at bigger counties like Cascade County, and just a few days ago, their hospitals were at 100% capacity. I was wondering if the county was doing anything special to keep people out of the hospital, and what is that?
No, we're not doing anything to keep people out of the hospital. We want people to seek care when they need it. That's the whole point of the community interventions that we're trying to put in place, because we know when we ask people not to go to the hospital, that has negative implications. And so right now, from everything we've gotten from Bozeman Health, they're telling us that they have the capacity to continue to provide the services to the people who need those services. There's some things that they have to do in order to continue to do that now, but we are not advising people to put off visits for healthcare if they need healthcare.
I guess I was wondering why, how are we able to keep up with demand here compared to other places like Cascade County?
Well, there's a little bit of good fortune in it. I mean, Bozeman Health just went through an expansion and they have a little bit more real estate to work with. That's opened up some capacity in some of their areas. There's still demands on staffing that are significant. I think we're also behind where Cascade County and Yellowstone County were at those really high numbers for probably several weeks. I don't want to put a number on it because I don't know exactly, but there were several weeks where we were still under, we were trending at 40, 50 cases a day, and they were, Yellowstone County was significantly higher than where we were. So I think we're behind them. I think that's had an impact. And I think we've got a little bit lucky in that, even before the pandemic, Bozeman Health had an expansion plan, and that happened to open up right around the middle of the summer, and that's provided some some additional capacity. Anything to add there, Callie? I don't know.
Yeah, we have our new critical care unit, which has significantly helped us. We were able to speed up the build of that, which was very helpful. And then we were able to make changes to the design of that unit during the construction as well, so that we could accommodate more COVID types of illnesses or respiratory illnesses that require specific pressure in the room. So we were able to make those changes while we were constructing, which was extremely helpful for us. And then we did open our family birth center, our women's and children's tower. So that gave us an additional amount of rooms that can be used for medical or surgical patient beds. So we were able to use that. But as Matt said, staffing, it does, you know, we could have the beds, but if we don't have the staff to care for the patients, it can be extremely challenging. You talk about burnout as well, Matt. I think there are many, many staff members who are having a challenging time right now, both in their, with their professional life, but also with their personal life. You know, we are members of this community as well. We have children, we have partners, we have other household members, and it's very tough all around for everyone, like you said.
Yeah, I would second that. I think we focus on beds. We tend to focus on inanimate objects, right? Mm-hmm. Square footage and beds when we talk about hospital capacity. And the most important thing in the hospital are the people who provide the services. And we've all been at this for 9 months now, and it is hard, and it's taking a toll. And as we talk about hospital capacity, I want people and people making decisions, I want them not just to think about the number of hospital beds, which are it's a finite number, but also think about what Callie said, the men and women who are in those settings, who are going home to their families every night and having to deal with the stress of work, and then having to deal with the stress of everything else that we're all dealing with. And that's happening not only in hospitals, it's happening in rest homes and long-term care facilities. There's not a day goes by that I don't talk to a teacher who's under an enormous amount of stress. Law enforcement, just kind of across the board, is taking its toll.
Hi, I have a couple questions. Callie, I was curious when you mentioned the, one second here, let me find it. Just when you were saying that there would be work assignments for people, appropriate work assignments for the people who are coming back a little bit early from their quarantine. Can you give a couple examples of that? And I'm also curious how many staff are in quarantine right now?
So I can't give exact numbers on quarantine, but I can say that we have enough that it's causing a major constraint on our system. And the majority of those are community acquired. So, you know, we are finding that it's not happening within the walls of our building, it's happening outside. And that's why we really urge the community to help us and to follow those health orders and all of those scientifically based prevention measures. You know, we're learning now that masks not only prevent spread, but they protect the wearer as well. So, you know, all of those things are extremely important. But to answer your question a bit, we, of the staff who would be coming back, they have an individualized infection prevention expert evaluate all of the measures that they're doing. We look at staffing and we partner with those operational leaders in those units. So I could give you a quick example, like in our emergency department. Since the beginning of all of this, we have separated respiratory illness patients from non-respiratory patients. So what we would do is make those staff assignments of those people who were on provisional work orders to come back. They would work on our respiratory side, knowing that we will put all sorts of measures in place to prevent transmission from those individuals if they were asymptomatic. But we do try to make accommodations in that arena. There are places in our facility where we cannot separate respiratory ill from non-respiratory ill patients, something like our operating room. So it's a department by department basis, and we do have an expert in-house on infection prevention who assists with guiding those decisions. And then we partner with our health department as well We meet with them regularly during the week, and we are just a phone call away from one another. So it's been pretty great to have access to all of those experts in the community and within our facility to help make those types of decisions.
Questions?
And just
Sorry,
double
go ahead.
checking, that change happened on November 6th.
Which change?
No,
Sorry,
that was the date. That was the date. The November 6th date was the date of the guidance was updated. That was when, I didn't mean to implicate, I didn't mean to say that that's when Bozeman Health did the change.
We have had these guidelines in place for the different modes of operation for staffing since the beginning of the pandemic. We knew that at some point we had the potential to face, either staffing shortages or staffing constraints. And so we developed those guidelines in the very beginning of this pandemic and have been using them in the meantime. But we haven't had the amount of constraints until recently on staffing, and we haven't had to put those measures in place until recently.
Go ahead, Freddie.
Did you have to put those measures in? I'm sorry.
Recently, we did that this week.
Jonathan, you had a question.
Yeah, so I guess I wanted to follow up on something Callie said about the tests. If you said if tests are coming back in a timely manner,
Mhm.
so are tests coming back in a timely manner? And are the workers getting tested, or some of them getting tested and some of them aren't? I guess I just wanted to just make that a little more clear.
Yes. So what to make that a little more clear, we are testing them now. Getting results back before they can work is another aspect of that, right? The turnaround times weigh into that. We may not be, if we have 2 spine surgeons in the community, we can't wait for results to come back for them to come in and take care of a trauma. So that's what I mean by turnaround times. And we would want to test them. We would want to have those results, but we are challenged there as well. And we would look at that and maintain the safety of whatever patient care was necessary in that moment.
Hey guys, Whitney tells me I said the number 216 for some reason. We had 286 cases yesterday. I don't know why I said 216. Our dashboard is correct.
Matt, this is Perrin. I was wondering if you could talk a little bit about whether you guys at the health department are continuing to see testing shortages or lag times with the returns from the state and how that's affecting your work.
I'll actually be really interested to see our surveillance report in the morning to see what our median time is. I haven't seen that in the last day or two. Anecdotally, we're hearing that there are some delays that are happening. But I think it's safe to say the system is being stressed and we're seeing longer wait times in some instances. I'll wait till tomorrow until we get that median time to see what that looks like. I'd also be clear that that's, a system-wide problem. We have Bozeman Health is doing some testing, but we've got MSU is running tests. We've got a number of reference labs out there that are providing tests, and then there's the state public health lab. So, it really depends on the day. It depends on what lab you're talking about, and it depends on kind of the luck of the draw sometimes, but we are seeing some delays. And we'll report a more specific week-long figure in our surveillance report tomorrow. Other questions? Okay, I appreciate all your time. We'll come back at you tomorrow. We'll get the surveillance report out. I really appreciate Callie being here and being able to answer some of those more specific questions. And I hope you all have a great day.